Good morning. Welcome to the AARP Live Teletown Hall with our guests, Congressman Frank Pallone and State Senator Joseph Vitale. I am your host, Patricia Kelmar. We'll be talking this morning with thousands of AARP members in New Jersey about health care reform on both the state and federal level. Congressman Frank Pallone holds an important position in Congress as the chair of the House Health Subcommittee of the Energy and Commerce Committee. This committee is charged with working on the very important task of health care reform. And also with us this morning is State Senator Joseph Vitale, who is the chair of the Senate Health, Human Services, and Senior Citizens Committee, a committee very important to addressing state health care issues. Once again, welcome to this live AARP Teletown Hall with our guests, Congressman Frank Pallone and State Senator Joseph Vitale. I am your host, Patricia Kelmar. Today we'll be talking about health care issues. We know that people are paying more and more for health insurance. The cost of prescription drugs continues to rise. And as more people lose their jobs in this tight economy, they are also losing their employer-sponsored health insurance. These are important issues to AARP members, and we'll be discussing them today in our call with Congressman Frank Pallone and State Senator Joseph Vitale. If you're just joining this call, you are participating in a live Teletown Hall sponsored by AARP. In a moment, we'll get started, but just to let you know, we will be taking questions live on this call. So if you have a question for either Congressman Frank Pallone or State Senator Joseph Vitale, press *3 on your phone. Your call will be answered by a live AARP representative, and we will take your question. Again, press *3 on your phone to ask a question of Congressman Pallone or Senator Vitale. Or, if you'd like to share a story about health care and your ability to get health care insurance, you can also press *3 to talk to one of our operators. As we now have over 300 people joining the call, I would like to welcome our guests, Congressman Frank Pallone and State Senator Joseph Vitale. Thank you so much for being with us today. Congressman Pallone, would you like to say hello to the people on the phone?
Absolutely. I appreciate the fact that AARP is putting together this teleconference town meeting, essentially, and I think it's really important to get input because as we move forward on the federal level with healthcare reform, and we're in the midst of it right now, we want as much input from the public as possible, and I know that the AARP always provides that and has the opportunity for grassroots participation, which is wonderful.
Great, thank you very much. That was Congressman Frank Pallone, the chair of the House Health Subcommittee of the Energy and Commerce Committee. And for those who are just joining us, you're joining a live AARP Teletown Hall. Senator Vitale, would you like to say hello to the people on the phone?
Yes, thank you. Good morning. It's a pleasure to be here. It's a great opportunity because we don't have a chance to get together in one place, but do it in this way that's virtual, over the phone. Really gives us an opportunity to reach out to people throughout the state and different parts of our community. Congressman Pallone's comments earlier about healthcare reform is certainly important on a federal level. They've been great partners with us on the state level. I'm going to continue that partnership, and hopefully that when reform does happen, we're all in this together and work together to make so.
Absolutely, and AARP is committed to working on both the state and federal level to make sure that healthcare reform becomes a reality this year. That was Senator Vitale, and I also have with me Congressman Frank Pallone. We have hundreds of AARP members on the phone with us right now, and I think we'll start getting involved in the conversation on health care reform. So to get started, I'd like to ask you to give a little bit of an overview of health care reform. And first of all, Congressman Pallone, AARP wants to thank you very much for your support in the past and your leadership to ensure that our state health programs get the funding that they need through SCHIP. It's a wonderful example of how both the federal government and the state government work together to ensure access for low and moderate income people in the state. I was wondering if you might want to say a few words about the SCHIP authorization and the work that you do in Congress to ensure funding.
Well, first let me thank Senator Vitale on SCHIP because, as I think you know, the state of New Jersey really has taken the lead even beyond the federal government in many cases in trying to cover as many New Jerseyans as possible, including children. And Senator Vitale actually testified a couple times when we were moving the SCHIP bill, both in the previous Congress as well as in the current one. The bill was signed into law a couple months ago by the President, and basically it has always been a state-federal partnership, as you mentioned, Patricia, where the federal government gives some money to the states and the states match it The new aspect of this in the legislation that was signed by President Obama is that we're covering a lot more kids. In other words, the program was about 12 years old. Initially, it covered about 7 million children, but we never had enough money and probably didn't do enough outreach to reach all the kids that were actually eligible. And now with the new legislation, which is financed through an increase in the tobacco tax, we're talking maybe another 4 to 5 million children that would be covered.
Great, thank you very much. That was Congressman Pallone. And just so people understand, SCHIP is the State Children's Health Insurance program, and that enables the states to get the funding through the federal government to help support state programs. Senator Vitale, I do know that you are a leader in healthcare reform, and particularly in the New Jersey Family Care Program in the state. It's a very important program, and I'd like you to tell our members a little bit about it, because perhaps they have individuals in their family who might be able to benefit.
Thank you. More than likely they do. It began in New Jersey in around 1998, and it was, again, a federal and state partnership. The federal government said that we have this great idea that if the states were to match the money, that we can provide funding. So the federal government basically provides 65% of the funding, and the states 35% of the funding to offer a health insurance plan for children. It began exclusively for children back in those days, and continues to provide that coverage. Now we're covering some lower income working parents in the program as well. And so it's a great way to maximize federal dollars with a smaller state match, and where it's possible, parents pay a little bit of a premium based on their income to participate as well. So that's also based upon the making it affordable for them. So, but it's given access to well over 500,000 children, access to primary care, to a pediatrician, to a family doc, so they get the care when they need it and where they need it, so it's dependable. And for those parents that we're now covering, it gives those working parents who would never really have the opportunity to have health insurance because their employer more than likely doesn't provide because of cost, or can't because of cost, an opportunity to get the dependable care that many of us take for granted. We have commercial policies or policies with the government, and here we sit in judgment of others, and I think it's a great way in which to provide the care that people deserve to have, and the government plays that major role.
Patricia, I should point out that the numbers I gave were nationwide, the numbers that Senator Vitale is giving you for the state. I didn't want you to think there was a discrepancy there.
Great, thanks for that clarification. If you're just joining us, you're on a live AARP Teletown Hall, and we're having a discussion about state and federal health care reform with Congressman Frank Pallone and State Senator Joseph Vitale. We have over 2,000 individuals who have joined the call, AARP members who are interested in this topic. I think we are taking live calls. If you do want to ask a question, you can press *3, and we will take your question that you can ask of either of our guests. And we're going to take Mary from Allenhurst live on the phone. Mary, are you there?
Yes, I am.
Would you like to ask your question?
My question is, there are many of us who are not at the lowest point in the economic scale, but that are having a little difficulty at this point with our prescriptions. I can't get any more samples of Prevacid, for instance, which I have to take, and I spend about $400 a month just on that one medication. And it really eats into my income, which is limited. And I don't know if there's anything that we as a group from AARP can do about it, or if you, Senator Pallone, who I've met before, and he's always been very kind to so many of us, senior citizens. I don't know how to go about this or to be of help to anybody else that's in my situation. Do you have any suggestions?
Well, I guess I would ask, thank you for the compliment, but I would ask initially, so we are talking about senior citizens then? In this case, in other words, someone who's eligible for Medicare over 65?
Yes, but is not in the economic place of being destitute.
Right, but what I'm saying is if you are in Medicare and over 65, then you do have Medicare Part D coverage, correct?
Yes, I do.
Okay, but the problem is that with the cost of the, it's not covered. Why? Because you're falling into the donut hole, or what's?
Yet, not yet, but my particular plan will not cover that one, and I have the middle plan.